My name is Eric Barsatan, and I'm the Manager of Physician Relations and Medical Staff Services here at the Queen's Medical Center, West Oahu. The title for today's Speaking of Health is Continuous Glucose Monitoring. Is it right for you? Right now, to the presentation, you could ask all our viewers to be on mute. And if you have any questions, please type your question in the chat box and our speakers will answer them at the end of the presentation. This time, I am honored and privileged to introduce our speakers. November is National Diabetes Month, so we are fortunate to have Sayako Hackler and Saito doing a presentation for us today. Both Sayako and Hang are APRN at our Diabetes Management and Education Center here at the Queen's Medical Center, West Oahu, and they're located at our physician office building. Welcome, Hang and Sayako. You may now proceed with your presentation.
Thank you, Eric. Can you hear me okay?
Yes.
Oh, good. Hello, everyone. Thank you for joining us for our November Speaking of Health talk on continuous glucose monitoring. So as Eric mentioned, my name is Saito, and joining me today is my colleague, Sayako.
Hi, I'm Sayako Hackler. I'm also one of the diabetes nurse practitioners here at Queens West Diabetes Management and Education Center.
So last year, we discussed the importance and benefits of glucose monitoring as part of our managing diabetes regimen. We discussed that this is the most common way to check your blood glucose via the glucometer and utilizing a drop of blood, usually from your finger, to measure the glucose at that point in time. This year, we're going to be focused specifically on another method of monitoring that has been increasing in popularity these recent years. It's called continuous glucose monitoring, or CGM. So let's try and see if we can advance. Yeah. So what is CGM? As mentioned, it's a newer way for people living with diabetes to continuously measure glucose day and night without the need to perform finger sticks measurements. So it has become so popular and more accurate over the years and is now considered a viable treatment option for people with diabetes. So how does it work? Essentially, a CGM system has three components. One is the sensor, which is a small wire catheter, which is a small wire catheter that is inserted underneath the skin. Then you have the transmitter, which is the second component, which is attached to the sensor, and a handheld receiver or smartphone that displays the glucose data in real time. So how it works is that the sensor specifically, specially formulated in that it's covered with enzymes that detect glucose, the surrounding glucose in your tissue area, and it sends that data to your transmitter, which then transmit it to your device, which could be your receiver or your smartphone that you can see the reading as shown in the slide. Yeah. All right. So you may be wondering, what is the difference between the two glucose obtaining methods? Are they the same? Are they both accurate? Well, the reality is the finger stick measures glucose at a single moment in time, represented here on the slide with the big red dots. So if you look at this slide, on the left-hand side, it shows you the concentration of the glucose level. And on the bottom, it shows you the time that the individual checked their finger sticks. So on this slide, they checked it at 9 o'clock, 2 o'clock, 7 o'clock, 8 o'clock about, as well as 7 and 9 p.m. At 9 a.m. Sorry. On the continuous glucose monitoring system, it continuously checks glucose throughout the day and night. So when you look at this picture, you could tell that they are obtaining 2, 3, 4, 5, 6 points in time of the day, and it looks pretty good with only one being out of range around 6 o'clock, being a little high. However, you look at the continuous one, you can definitely see a bigger picture as well as the unnoticed high that you notice under the peach curve. And then more importantly, the unnoticed lows under the pink curve, which can be more dangerous, right? Okay. So are the finger stick glucose readings the same as the CGM sensor readings? So in general, finger stick glucose readings is more accurate than the sensor glucose readings. So there will be times when there are discrepancies in these two readings, especially at times of rapid glucose changes. For example, when you're eating and after you're eating, right? So as demonstrated on this slide, you see that the roller coaster, if you will, with the first car being the finger stick glucose and the last car being the sensor glucose. So when the train goes or the roller coaster goes up, like when you're eating and the sugar goes up, your finger stick glucose will go up first. Then the sensor glucose will follow, but there's a little bit lag in time. Yeah. So similarly, when the roller coaster goes down, the finger stick blood glucose in the first car will drop first, and the sensor glucose in the last car will drop second with a little lag in time. Yeah. So in contrast, in times of glucose stability, such as times of fasting, both of these finger stick and sensor glucose should be fairly consistent. Now, this is important to keep in mind because when you track your glucose, especially with meals, you can know what to expect and plan for these differences. Okay, so speaking of tracking your glucose, CGM can communicate information on trends on your glucose data to highlight the direction and speed your glucose is moving with arrows. So these trends tell you if your glucose is going up, down, or stable for a period of time. So let's look at these arrows and see what they actually mean. So with the first arrow that has the arrows pointing directly to the right, it tells you that your glucose is increasing or decreasing less than 1 point each minute. So if you have the arrow on the second one pointing up or down at a diagonal direction, your glucose could be increasing or decreasing 30 to 60 points per 30 minutes, in 30 minutes. If you have one arrow going directly up and one arrow going directly down, the glucose could be increasing or decreasing in 60 to 90 points in 30 minutes. And if you have two arrows pointing directly up and two arrows pointing directly down, that means it's faster, right? So glucose could be increasing or decreasing more than 90 points in 30 minutes. All right, so CGM system also provides an alert via alarm to let you know when the glucose is too high, too low, or when you're trending out of the target ranges. So these target ranges will be set depending on your personalized settings. This alarm system can provide you with a peace of mind by giving you a heads up to alert you when to take timely actions to your glucose readings. And this is especially very useful for folks who are not aware that they're having hypoglycemia or low blood sugar. And it's very useful, especially if you're concerned with having the low blood sugar in the middle of the night.
So why do we use CGM? Well, we use CGM because it's recognized as a standard of care in diabetes management by the American Diabetes Association, the ADA, the American Association of Clinical Endocrinologists, the ACE, and the Endocrine Society. Studies show regular CGM use has proven to reduce both A1C and time spent in hypoglycemia. CGM use is also associated with many behavioral changes that promote significant positive changes in one's diabetes management and has been proven to improve quality of life. So to elaborate further, CGM provides a bigger picture of glucose control. The data shows a more complete picture of how your blood glucose levels change over time in real time and how it's affected by things like medications, food, activity, stress, and/or illness. CGM assists in having more personalized care. So because CGM can help you and your provider to recognize and discover the reasons for your trends, medications or lifestyle adjustments can be personalized based on your needs. CGM alerts you to highs and lows, like we just discussed with the alarms. With this information, you can make changes quickly So you may be able to treat or prevent highs or lows before they turn into a big problem. This can potentially save money through improved diabetes management and fewer events like hypoglycemias that can lead to emergencies. CGM reduces the amount of finger stick checks needed. So this can significantly reduce burden with that amount you'll need to do every day. So how is the data interpreted? Well, this is an example of a report that's generated from downloaded CGM data. With all of the information available, the CGM report organizes your information into important categories and creates a glucose profile for your healthcare provider to review. CGM profiles are reviewed for things such as average glucose readings. As you can see in the graph here with the blue is that is highlighted by the dark black line. We also look at things such as how much of the time you're in range and what range your glucoses are in. And that's categorized into very high, high, in the target range, low, and very low. It also, we also review it for periods of glucose fluctuation, so that variability of it going up and down. And then also the patient usage, so your consistency with usage of the device. And using all of this data is how we drive your personalized adjustments. So what types of CGM are there? There are 3 types of CGM devices. There are real-time CGM, which are personal systems that you own that measure and display glucose levels continuously. There are intermittent scan CGMs, also personal systems that measure glucose levels continuously, but require scanning for visualization and the storage of glucose values. And then there's also professional CGM, which we don't dive into too much into this discussion, but that's a clinic-based system where we place the sensor and transmitter on a patient, and you wear that for a limited period of time, so about 7 or 10 days. Then you come back to the office and we remove the sensor and transmitter and download that data to review and assess glycemic patterns and trends. So technology is evolving rapidly, but these would be the most current available monitors that we'll discuss in this talk. So we have the Freestyle Libre systems, which include the Freestyle Libre 14-day, the Freestyle Libre 2, the Freestyle Libre 3, which is the most recent, most accurate, and then the Freestyle Libre Pro. And then the Dexcom systems, we have the Dexcom G6, the Dexcom G7, which is the newer, more accurate sensor, and the Dexcom Pro. And then there's the Medtronic Guardian systems, which include the Guardian Connect, and then the Eversense E3 system. So in the next few slides, we'll go into the differences between each of these systems. Each CGM has different features, indications, pros and cons. So here's a layout of the Freestyle Libre system. Like I said, I'm not talking about the Pro, so we just have the 14-day, the 2, and the 3. So some of them are pretty, some of the systems have very similar similarities, so I'll kind of group those together as we go. For all of the 3 sensors, Freestyle sensors, they're indicated in ages 4 years and older. The sensor lifespan is 14 days for all. The sensor placement is indicated for the back of the upper arm. The size for all, again, are for the Freestyle 14-day and the Libre 2 are the size of about 2 stacked quarters. And the Libre 3 is about the size of 2 stacked pennies. The components include all-in-one sensor and transmitter for all. The glucose reading frequency is every minute for all. And the warm-up period is 1 hour for all. The Bluetooth range, now the Freestyle 14-day requires scanning to get data. The Libre 2 is 20 feet and also requires scanning. And the Libre 3 has a 33 feet range and no scanning required. There's an iPhone app for all for iPhone and Android. And there's alarms available for only the Libre 2 and the Libre 3. The 14-day does not have alarms available. There are, for calibration, there's no requirements. However, it's recommended to perform finger sticks when symptoms do not match the CGM values. The waterproof and resistance for all is also 3 feet for up to 30 minutes. And medication interferences can include vitamin C if you take more than 500 milligrams a day. That can make your values appear higher. And then here's a layout of the Dexcom systems. So we have the Dexcom G6, and then we have the Dexcom G7. So the Dexcom G6 and G7 are both indicated in 2 years and up. The sensor lifespan of the G6 is 10 days. For the G7, it's 10 days plus a 12-hour grace period. The sensor placement is indicated in the abdomen for the G6 or upper buttocks for ages 2 through 17. Also for the G7 is but for the G7, it's the upper back arm or the upper buttocks for ages 2 through 6. The size is about a little more than 1.5 inches, close to 2 inches for the G6, and closer to about 1 inch for the Dexcom G7, similar in size to the Freestyle Libre 2. Components for the G6, there are 2. So it's a sensor plus a transmitter. For the G7, it's an all-in-one sensor and transmitter. The glucose reading frequency for both is every 5 minutes. The Bluetooth range is 20 feet for both. There is an app for iPhone and Android for both, and there are alarms, highs and lows alarms available for both. The calibration, there are no requirements for both. However, you should perform finger sticks when symptoms do not match the CGM values. And for the Dexcom G7, there is an available calibration option in there. If you can check your finger stick, you're able to kind of put that data in there to let the system know. And the waterproof water resistance is 8 feet for up to 24 hours for both. The medication interference includes acetaminophen if you're taking more than 4 grams a day, but that's above the max recommended, anyway. So most people are not, however, that's something to consider, and hydroxyurea. Okay, so the Medtronic CGM, this is discussing the standalone CGM because they did come out with a more accurate CGM that goes along with their newest pump. However, this is for just using the CGM device, which is the Guardian Connect. It's indicated in ages 14 through 75 years old. The sensor lifespan is 7 days. The placement can be in the abdomen, arm, or buttock. The size is about 1.5 inches. The components include both a sensor and a transmitter, so 2 pieces. It reads your sugars every 5 minutes. There's a warm-up period of 2 hours. The Bluetooth range is about 20 feet. There are iPhone and Android apps for the phone available. There are alarms, plus there's a predictive alert alarm. So these are alarms that can go off 10 to 60 minutes before blood sugar changes. So that's a nice perk there. Waterproof or water resistance is 8 feet for up to 30 minutes. And the calibration requirements, it's a little lengthy, but 2 hours after you connect the transmitter, plus within 6 hours of a first calibration on the first day of a new sensor, every 12 hours after calibration when you're prompted to calibrate, and also whenever you're prompted to calibrate and symptoms do not match your CGM readings. Medication interferences include acetaminophen, alcohol, and hydroxyurea. Okay, then we have the Ascensia Eversense CGM. This is the Eversense E3 is an implant. So it's inserted and removed in a trained healthcare provider's office. It's indicated in ages 18 and older. The sensor lifespan is 180 days, so 6 months. The sensor placement is implanted under the skin of the upper arm. And the size is pretty small, about 3.5 millimeters by 18 millimeters. The components are an implanted sensor plus the external removable transmitter. The glucose reading frequency is every 5 minutes. There is a warm-up period of 1 day. The Bluetooth range is not applicable because the implant is, the Bluetooth range, you need to wear the sensor to get the readings. So you have to have the sensor on to get readings, the transmitter on to get readings from the sensor. The phone app, it's available for iPhone or Android. There are alarms and also on-body vibe alerts. The waterproof, water resistance, not applicable for the implant because it's under the skin. And the transmitter is 3 feet up to 30 minutes water resistance. The calibrations is from day 1 through 21, twice a day. And then after day 21 is once a day or when symptoms do not match your CGM readings. Medication interference includes mannitol and tetracyclines.
Wow, that was very thorough, Sayako. Thank you.
Lots of information.
So now that we have reviewed the current available CGM systems, we will discuss further as to who can benefit and who may qualify to use them. Yeah. So who can benefit? All patients with diabetes, patients on insulin or high-risk hypoglycemic medications, patients at high risk for hypoglycemia, or those who are not even aware they are hypoglycemic, patients who want a better way to meet their glycemic goals or convenience per their preference, patients experiencing excessive glycemic variability throughout the day or night, patients who may benefit from data sharing, for example, the young children or the older adult population, or lastly, patients who are unable to perform their own finger stick measurements due to either physical or visual impairments. So although CGM is a tool that is very useful for all those living with diabetes, there are still many insurance restrictions in the United States as to who may qualify to use these systems. So many insurances companies right now still require individuals with type 1 and type 2 diabetes to be on multiple injections of insulin daily or be on an insulin pump. So you may qualify if you are a type 1 diabetic, type 2 diabetic on insulin injections, history of severe hypoglycemia, persistent poorly controlled diabetes, or have a wide fluctuation in glucose levels. And in addition, some insurance will also require patients to have completed individual or group education in diabetes self-management, perform multiple daily monitoring of finger sticks, and have the ability to adjust insulin based on the carb intake as well as the blood glucose values.
Okay, while CGM is a very useful tool, here are some additional considerations. Some of the cons include cost. So if you do not qualify or if you're uninsured, then the out-of-pocket cost may be more than you can afford. That could become an issue. The data overload. So with all the information displayed or that's available, this can create increased anxiety or stress on trying to interpret all the data or know what to do with all of it, especially if you have underlying anxiety already. The skin irritation is can be an issue if you have sensitive skin. There may be issues with the sensors sticking or staying in place. This may cause you to need more products to keep the sensor to stick, or also keep it in place, and then also cause you to need to change the sensor out more frequently. You may experience sensor or transmitter failures, and this can be anything such as connectivity issues. So it might be your phone not linking up with the sensor, or your internet. You can have it could be because of a production issue. So sometimes we do see that sensors come out of the factory and they kind of had a bad batch. So you might have to continuously replace your sensors due to that. Accuracy issues can be a problem for some people. Although these CGMs are studied, everybody's a little different. So the blood glucose, as we mentioned, is still going to be more accurate, reading it through your meter. However, the accuracy issues can potentially become a barrier. It's not compatible with imaging such as MRI, CT scan, or high frequency electrical heat treatments called diathermy, but you'll need to remove your sensors and reinsert them after the procedure is done. There's also some areas lacking data and guidelines. That includes patients that are on dialysis. Now, a lot of patients do use these devices while on dialysis. However, because of the lack of data, we recommend them as adjunctive use. So alongside with still performing finger sticks. There is not enough data in critically ill and ongoing use in overall inpatient use.
So in conclusion, CGM should be available to all diabetics or people living with diabetes, and in the future, non-diabetics as well. That's a mouthful. But it is our hope, though, because it's such a convenient tool, we hope that it would, the insurance company would have a greater access for patients living with diabetes so that they can utilize and provide them with data to be proactive and allow for personalization of the diabetic care. So before you start on your CGM journey, ask your provider if it is right for you. Find out your insurance coverage and if it is an affordable option for you, because there might be copay and out-of-pocket costs. Review different devices like we just shared and request free trials to see if it's the best option to fit your needs. And to get the most out of your CGM usage, make sure you use it regularly and change out your sensors and transmitter timely. Pay attention to alarms, trend the arrows, and calibrate when needed. Lastly, keep a thorough log of your medication, insulin dosing, food, activity, exercise, and finger stick results to review with your provider at each visit.
We definitely appreciate that.
Yes. Here are some of our references. And thank you for joining us today.
Thank you very much, Hang and Sayako, for another informative presentation. Right now, we'll proceed with the Q&A or question and answer portion. Again, if you have any questions, please type them in the chat box right now. Let's take a look if any. Okay, actually, we have one. It says, for the alarms, do they come with manufacturer's settings, or they have to be set even for hypoglycemia?
Yep, so you can set your own parameters based on your needs. The one alarm that does come from the manufacturer is the super low blood sugar, because that's dangerous. That has to be addressed. So that needs to be kept on. And I believe it's at 50 or...
Yeah, so each device is a little different, but for the most part, you can customize your alarms, especially for high, because some of the times we start patients that come in with a very high A1C, and they're already used to running pretty high. And if the high alert is set to 240, then that, like I said, again, you'll have that alarm fatigue because it'll be going off pretty much all 24, the whole day. So it is customizable. However, there are prompts for certain systems where you cannot turn off that low for the low alert for the very low.
For safety reasons.
Okay,
Good
very good.
question.
Yeah, another question is, if on pills instead of injections, would you qualify for glucose monitoring?
Very good question. So if you're only on orals, right? So every insurance is a little different. So we can't actually answer to specifically for you unless we had all that information and we try to send in a prescription and kind of see what you qualify for. So what I recommend is that you call your insurance company and just see if they cover CGM first of all. Interestingly, we actually found out that there are a couple of insurance plans that even cover CGMs regardless. So if you're a Queens employee, you can actually get the Dexcom. You just have to pay the copay for it. So this is for non-diabetics also, right? Yeah. So if you're, this is only for Queens health plans. Other than that, there's a lot of other insurances. It just depends. Most of the time, as Heng mentioned in one of the slides, that you have to be on insulin. But if you do have a history of having hypoglycemia or low blood sugar, sometimes Medicare will cover in that case. And then if not, it might become an out-of-pocket cost to you. So we kind of have to see everything all together. If you're on pills, and especially pills that cause low blood sugar, or if you have issues like with dexterity or vision, then it could be something that we might have to just request and on your behalf, write an appeal to get it for you. But generally, most of the time you need to be on insulin. Like I said, but there are a few insurance companies that will just cover CGM. You just need to inquire.
Very good. Another question is there still good benefit for patients who have less strict blood sugar control goals, like geriatric patients? Oh. For some reason we can't hear Sayako.
Can you repeat the question again? It was you were breaking up a little.
I'm sorry. The question is, it's also in the chat box. Is there still good benefit for patients who have less strict blood sugar control goals, like geriatric patients? So less strict blood sugar control goals.
Oh, so is there a benefit for CGM if you have a patient with less stringent goals? Is that what you're asking? Is that what the
I think that's the question, yes. Mm-hmm.
Okay. Do you want to see that or you want me to see that? I take it. Okay. So yes, I mean, like we mentioned, all patients can benefit, especially regardless of what your goals are. It's very important to be able to see the effect of everyday, like I said, medications, food, how it's affecting your diabetes. And so especially if you have a high risk of hypoglycemia or low blood sugar, we want to be able to see that, catch it before it happens. So even if your goals are a little bit less tighter, it's still very valuable to get all that information. So, maybe if it's something that constantly bothers them, or maybe their goal, like I said, their sugars are not really a problem with highs or lows, or they're not on medications that cause hypoglycemia, then maybe we don't need to see as much of it. So that's where it becomes more like their preference or a lifestyle thing. So are they comfortable with having to put the sensors, like changing the sensors out? Is it helpful to them? So then it just becomes more of, does this tool help them and help us to kind of get them to what their goals are? But regardless, it's a very useful tool to use.
I think for geriatric patients, what we think about is the dexterity, if they're able to do their sugar check, glucose check via their finger or not. Yeah. And the weakness of it, the ability for them to mechanically perform, as well as their eyesight to see if they can see it or not.
Very good. Another question that came on is, since there are a few brands for CGM, are there ones that you prefer or that you recommend?
So the main ones that we use are the first two that Sayako discussed, which is the Libre systems and the Dexcom systems, mainly.
Mainly, yes, yeah. And then between them, it comes down to what's covered under your insurance, what the out-of-pocket cost is going to be for you. So if you don't have insurance coverage, or your insurance doesn't cover it, then for example, the Libre systems, they offer like an out-of-pocket cost of $75 for 2 sensors. Whereas if you were to buy maybe one sensor of Dexcom, like the cheapest would be at like Costco, and that would cost like $86 for a sensor. So of course, getting the approval from the insurance is a big one. And then from there, it's really just, what fits your needs. Because if you don't like all the alarms, then maybe an intermittent scan might work a little bit better. And then your ability to change the sensors out, the timing of when you want to change it out too. So you kind of have to look at all of the what it offers. But that's why we really recommend that if you're interested in it and you're new to CGM, all of the companies, except for Eversense, of course, because that's a procedure, do offer a trial. So you can go even online to any of the websites, so Freestyle, the Abbott Freestyle, or Dexcom, and request like a free trial sensor. And then depending on if your doctor's office offers them, so we also do for some of our patients offer that as an option to kind of start off, and then you can see where it goes for you, because everybody has little different preference, and we do find that people are very happy with the newer sensors, the Dexcom G7 and the Freestyle Libre 3, because they're only applied to the back of the upper arm and they're very small devices and there's no scanning required, and the accuracy is the highest for both of those compared to all of the other devices that have been out on the market thus far.
Last question came up. Says, are Medicare patients eligible for the free trial as well?
Okay, so you to get those free trials, you do have to you won't be able to be a Medicare patient, I believe. But you can check and see, because sometimes you can get it even if you're not insured.
Mm-hmm.
So you just would list that you don't have, maybe, I think so. But if not, you can check to see if maybe your provider or your diabetes specialist, your endocrinologist, if they have sensors available, and that you can get a sample to try out.
That we do that a lot at the office, where we have patients who are unsure whether they're covered or not, but we trial it out to see how they like it. And some are willing to pay out of pocket, and some are fortunate enough to be covered by insurance. So it's like night and day for them. So you never know until you try whether Medicare or not of the device.
Very good. And I think that was the last question, but Hang and Sayako, I mean, since the holidays are already here, in fact, Thanksgiving is next week, do you guys have any advice for, I mean, since there's going to be a lot of potluck family gatherings, right? Do you guys have any advice, especially for those diabetic patients?
Yeah, oh yes, definitely. We all have bigger eyes and what we can take in, but I mean, portion control is probably your best friend. Eat your veggies and your proteins first, and then go for the sweets after. If you can modify any of your desserts to make it a little bit, lower sugar, lower carb option, then better, but just portion control. Yeah, portion control.
Yes. And also we want to celebrate these things, right? We want to celebrate life, holidays, time with family and friends. So we advocate for enjoying the food, but at the same time, we got to think about moderation and knowing those portion controls. And if relating to the CGM, I think this is really good in that it does show you
Oh yes,
real time
with the CGM.
of how your sugar is at that present moment.
We'll
and it
see how
gives
that
you-
stuffing goes.
Yes, but definitely enjoy and portion control as
And because it's holidays, you know, especially after you have a nice meal with your family, instead of sitting down and watching a movie or something, go for a walk or have a dance party.
yes, get moving,
Get moving after.
and you'll see your sugar drop with the CGM.
Excellent. Really great advice. Again, I'd like to thank once again our speaker, Saito and Sayako Hackler from our Diabetes Management and Education Center at the Queen's Medical Center, West Oahu. Also like to thank all of you, our virtual audience, for joining us today. And that concludes our Speaking of Health presentation for November. Again, the Queen's West Oahu Virtual Speaking of Health Lecture Series is the third Thursday of each month at 12 noon to 1 p.m. Please join us for the next lecture, which is scheduled for Thursday, January 18th, in the new year 2024. So look out for the announcement soon. On behalf of our Vice President of Operation, Robin Kalwilani, our Chief Medical Officer, Dr. Ronald Kuroda, and the entire Queen's Medical Center West Oahu Hana, mahalo nui lua. Thank you very much for joining us today. Until next time, happy Thanksgiving and happy holidays. Aloha.